So next up, without further ado or delay, let us welcome our very own superstar in the realm of professional service and also training and development from the Focus Point Vision Care Group, Ms Chia Jho Yan, to share with us on the topic nutrition and your eyes.
Hi, thank you for having me today. I'm Chia. So this is a brief introduction of myself. I'm the head of training and development in Malaysia, in Focus Point. I've been in Focus Point for more than 1 year now. I'm quite recent. I've been in the industry for about 15 years. I graduated from UKM. I've also did my master's a few years ago in UKM. So I spent about 7 years in retail and about years in so that's about me. So this is a summary of my profile. Okay. So today I'm going to share about a study called the AREDS. So AREDS is the age-related eye disease study. So this study actually covers on some nutrition that can actually help us to prevent age-related eye diseases. So this is divided to two sections, the 1 and the 2. So 1 is done in 2001. So it concluded in 2001. So it was done for a 6-year period, and there was about more than 5,000 participants in this study. So what they actually found, they wanted to study the risk factors of age-related macular degeneration. They also wanted to study effects of high doses of antioxidant and zinc on the progression of AMD. And lastly, they wanted to study they found that high levels of antioxidant and zinc can reduce AMD, age-related degeneration.
Okay.
So from the study, which was supported by the U.S. Health Ministry, they actually launched the supplements that can actually protect the eye, AREDS 1 and AREDS 2.
So the first one is regarding the first study, and the second is the outcome of the second study itself.
Yes, so they collaborated with Bausch & Lomb, which is this supplement company, and they actually launched the medication, the supplement.
Understand.
So this is the difference in the formulation. We can see that in AREDS 1, you have beta-carotene and higher dose of zinc. And in AREDS 2, you have lutein, zeaxanthin, and lower dose of zinc. So zinc, instead of 80 milligram, now we only have 25 milligram.
That's right.
So this is the improved formulation.
I see, okay.
Yeah. So as you can see, just now we mentioned omega-3 fatty acid has no effect.
Yeah.
So they didn't add omega-3 fatty acid inside. Yeah.
Understand.
So this is a kickstart to the topic that I'm going to talk about, which is nutrition and your eye.
Yep.
So we want to look at superfood that can actually help the eye, that can actually give you an optimal eye health.
Okay.
So first we look at lutein and zeaxanthin. So it's very effective to curb against the AMD, age-related macular degeneration.
Okay.
So some other studies, not the AREDS study, also found that it can actually lower risk of developing new cataract. So this is from the American Optometric Association. So where can we find this lutein and zeaxanthin? In the corn or maize?
Yeah.
Egg yolk. So this picture, I picked the yolk bigger because it's the yolk, not the whole egg.
Oh.
Yeah.
So egg white didn't help so much in this case.
Egg white is something else. So the lutein zeaxanthin is contained in the egg yolk.
I see, okay.
But then again, we should also note that egg yolk contains cholesterol as well.
Yeah.
So too much intake can also lead to high cholesterol. So it take with moderation.
And I believe a lot of people are having this question of how many egg yolks should be intake daily, right?
So
what is your recommendation on this?
Dietitian friend.
Okay.
She actually recommended you can take how many egg whites you want a day, but only 1 egg yolk a day.
Only 1 egg yolk. So the rest is only on the egg white part.
Yes. So you have to remove the yolk if you want to take more than 1.
Okay.
Yeah, but
Understand.
I know a lot of people that is in bodybuilding, slimming.
They'll take a lot.
They will take the whole egg.
That's right.
Yeah. So I think for those cases, there is a high risk of developing high cholesterol.
Okay.
Yeah.
Understand.
So and grapes, the red grapes.
Only the red.
Only
what about
the
green?
Only the red.
Only the red.
Yes.
Okay.
And this is spinach,
Okay.
kiwi, and broccoli. So broccoli is a personal favorite, my favorite. Yeah, so
Okay,
I,
okay.
I quite like food. So the second one is vitamin C. So vitamin C, as we know, is very beneficial for our health.
Yes.
So according to American Optometric Association, they also found studies that say that vitamin C can lower the risk of cataract, which is laput mata,
Okay.
and can slow down the progression of ARMD, age-related macular degeneration. So where can we find vitamin C? So first is, this is citrus fruit. So lime,
Okay.
oranges, what else do we have? Lime,
The
lemon.
soury foods, most
citrus
probably, yeah.
fruits. Then bell peppers,
Yeah.
strawberries.
Okay.
This is guava, broccoli, and tomatoes.
Okay. Among these 6 foods that you recommend, right? Which of it do you think have the highest content of the vitamin C that's needed by
If
us?
it's based on the article I was referring to, one of the highest is the citrus fruits.
Okay.
Yeah,
Okay.
yeah. So, but these are generally very good food. Then the next one is vitamin A. Vitamin A, vitamin E. So vitamin E deficiency has been found to be related to retinal degeneration and blindness. So vitamin E is very good in curbing or fighting against free radicals.
Okay.
So we can find vitamin A in nuts,
Okay.
in sweet potatoes, in broccoli, in spinach, avocado, and also almond.
Okay.
And yeah.
Just now in your previous slide, you are saying that vitamin E it actually help to prevent the free radicals, right? Actually,
Yes.
where do these free radicals comes from in our daily life?
Free radicals, where do it come from?
Where it comes from our daily life?
It doesn't, it's produced by the cell. It doesn't come from an external factor.
Oh, so our
So
own
it's
body.
like part of aging.
Oh, I see. It's
Yeah.
part of the aging process
Yeah,
itself
yeah,
to
something
produce
like
the free
that,
radicals. I see. Okay.
Yeah, okay. So then we have essential fatty acid. So this is a bit off track from our ARED study because just
Okay.
now we say that omega-3 fatty acid doesn't have much effect
yeah.
on the age-related macular degeneration.
But we still need it anyway, right?
We still need it. It's
Yeah.
actually quite important for proper visual development and retinal function. So what study has found is that it can actually fight against dry eye. It can
Okay.
prevent dry eye.
Okay.
And also, according to the American Optometric Association, it can also reduce the risk of diabetic retinopathy.
I see.
Yeah,
Okay.
which is a condition that develops if you have prolonged uncontrolled diabetes.
Okay,
It can actually
understand.
go into the eye. So essential fatty acids, we can actually get them from the tuna fish,
Okay.
fatty fishes, tuna, salmon, mackerel.
Okay. Including edamame as well.
This is edamame.
One of my favorites.
Yeah, I also like edamame. Yeah, then we have eggs,
Yeah.
walnuts, and chia seeds.
Which part of the egg again is the
The whole egg.
parts-
The whole egg.
The whole egg itself.
Yeah, the
I
whole
see.
egg,
Okay.
yeah.
Okay.
So that's that. Then next
Zinc.
we have zinc. Zinc is important because it's part of an enzyme that actually function as an antioxidant.
Okay.
So it's also part of formation of visual pigments of the retina. So what happens is if we have zinc deficiency, we can easily have impaired vision, poor night vision, and also cataract.
Okay.
So zinc can be found in red meat, beef, this is beef.
Okay.
Oysters, tuna, this is
Okay.
tofu, that is low-fat yogurt. And lastly, it's actually a combination of seafood. We have
Oh.
lobster, shrimp, and
Okay,
also
okay.
crab.
What is the function of the visual pigment in your previous slides?
Visual pigment is to see things.
To see things.
Yeah,
to see it more
things.
clearly.
Yeah, to see
more,
things.
More
Yeah.
HD.
Yeah.
Okay.
So then, of course, we are living in Malaysia. So some food are cheaper and easier to obtain, whereas some food are more costly.
Yeah, especially the
So-
salmon, all those is pretty costly, I believe.
So I would like to bring it to a more localized context
Yeah.
that we actually have food that can be grown and locally and found easily at
Yeah.
affordable price.
Okay.
That is also very good for the eye. So first we have Kailan. Kailan is packed with vitamin A and vitamin A and C.
Okay.
Papaya
Papaya.
is also A and C. Then this rambutan and
Ladies' finger.
rambutan and dragon fruit
Oh,
is
dragon
also
fruit,
packed
okay.
with AC. The last two is bayam and actually lady's finger. So bayam and lady's finger on top of AC, it also has zinc.
Oh, I see.
Yeah,
Okay,
so
okay.
these are very beneficial to the eye based on the studies just now as well.
I see, okay.
And they are not too costly.
That's right.
And
We can
also,
find even in pasar.
yeah, very easily
Yeah,
found, not too costly,
Affordable.
quite cheap, affordable, yes. And also, I have some recipes here. So generally, if you look at what we presented just now, we were talking about fruits,
Yeah.
fatty fish,
The
and
raw food
also
itself.
vegetables,
Yes.
green vegetables. So we can actually incorporate it in our daily diet. And I know a lot of people, they like to do shake or they want something simple and easy for breakfast.
Okay.
So we can actually consider smoothie in the breakfast time. We can add in banana and berries.
Okay.
Berries is very good. It has a lot of antioxidants.
Yup.
So it can actually prevent AMD as well. And
Okay.
also it promotes the retinal cells. So we have banana, berries,
Okay.
and also low-fat yogurt.
Okay.
Yeah.
Only
And
on the
if-
morning or any time of the day or so we can take this food.
Generally, I find a lot of people do it for the breakfast lah, but I don't think there is a
Breakfast.
limitation to which time of the day to have it lah.
Okay,
So these
okay.
are some suggestions. Both recipes are from. This is from Men's Health magazine. That's from
BBC.
BBC, yes, and they use the similar recipe. They have banana, berries. They have low-fat yogurt, which has quite a lot of nutrients, as we see
Yeah.
just now.
That's
and
right.
you can add in a bit of oats and a bit of chia seeds. It's very
Okay.
good for the eye.
I see.
Yeah,
okay,
so
okay.
this is actually my concluding slide. But based on the talk just now, we can understand that we basically need a lot of green veggie, a lot of fruits, and
Yup.
some fatty fish
Okay.
for the eye.
Okay, so I have a question right here is that, can you explain more on the effects of caffeine, like coffee and smoking? What is the direct effect on the health of the eyes?
Caffeine, I haven't heard much, to be honest.
Okay.
But smoking, we know that it can actually lead to accelerated ARMD.
Okay.
It actually has.
So it is a proven study for this, right?
There are, yeah.
Okay, I see. So basically to avoid like smoking, those as well will help to improve our conditions of the eyes as well. Am I
Yes,
right?
can prevent certain eye diseases. Yes.
Yeah, that's right. Thank you.
Smoking has also been related to formation of dry eye.
Formation of dry eyes, okay?
Yeah,
Oh.
yeah.
Is it something because like it is absorbing the moisture or absorbing
I
the
don't
moisture,
really know the
water
exact
in our body?
pathogenesis, but it's a risk factor.
Oh.
So meaning if you are smoking, you are at risk of dry eye more than a non-smoker.
Okay.
Yeah.
I understand that. Okay. Yeah, that's right. And thank you so much to
Thank
Ms. Chia
you.
Jho Yan for the valuable insights that you have
Yes,
been
thank
given to all of
you.
us throughout the session. Yeah, so once again, ladies and gentlemen, that's all for the public health talk by the professionals that we are conducting today. So once again, we really hope that you gain some knowledge and also insights on how to take care on your eyes health, okay? Especially through this session, the food intake part, okay, the food consume part. So for your information, once again, you can now enjoy free eye screening conducted by our group of very professional optometrists using really a lot of these kind of high technology equipment to check your overall eye health in a more detailed and also comprehensive outcome to understand more on your eyes. Yep, that's right. And also not forgetting to tell you as well that on next week, the 19th of July, we will be having 2 more sharing by Assistant Professor Dr. Teo Sui Chai on the topic, what is optometry and also the digital eye strain happening right here is called IOI City Mall, time at 12:30 p.m. and also 1 p.m. Thank you so much.